Hello, Alt Fam. We are here for another super duper presentation by KJB, otherwise known as me, Kara Jean Bry, LPC. And today we are talking about why everyone's talking about fentanyl. So thank you for watching. Thank you for coming. Our reason for being here is simple and clear. We want to increase the understanding of the dangerous rise of fentanyl so that we can come together to take action for our community and the kids within it. Arizona is seeing a spike in overdoses and has been for years, and overdose deaths related to fentanyl. So, thousands of counterfeit pills are confiscated by the police, and they contain a deadly amounts of fentanyl. It can be found across our state and in any community.
Hannah was your average teen, good grades, was friendly to everybody. It was just an accident. She was here one day and gone the next. They yelled for me to come inside. That's when I came in and I knew right away she was deceased. We called 911, the neighbors came over to help, and next thing you know, our house is upside down. This is a serious issue. She's not coming back, but we're gonna carry on the fight in her name.
Learn more at talknowaz.com.
Hannah was your average teen.
So that's just
good
one
grades,
family story,
was
and there
friendly
are
to everybody.
multiple families
It was just
throughout
an
Arizona
accident.
that have
She
that
was here
same
one
story.
day.
There's three aspects of this issue, like what the heck is fentanyl anyway? We want to give you a better understanding of what it is. Also, we'll talk about how big the problem is and what's driving it, and what can we do. As family and members of a community, we need to know what to do about it. This is important so we can work together to save lives and prevent other people trying this stuff. So to begin, let's look at what fentanyl is. Fentanyl is an opioid. These may be some prescription opioids you might be familiar with. Prescription opioids include Percocet, oxycodone, and actual fentanyl. Fentanyl can be a prescription. It usually comes in a patch or a liquid solution, and it also is illegally manufactured. Both are considered synthetic opioids. Pharmaceutical fentanyl prescribed by a doctor is meant to treat pain, especially after surgery or for advanced stage cancer patients. Fentanyl is a synthetic opioid that is 50 times stronger than heroin and 100 times stronger than morphine. However, most recent cases of fentanyl-related overdose are linked to illegally manufactured fentanyl, which is distributed through illegal drug markets for its heroin-like effect. It's often added to other drugs because of its extreme potency. This makes drugs more cheaper, more powerful, more addictive, and definitely more dangerous. Several different types of opioids in this class. We all know how powerful heroin and morphine are, and this strength is cause, especially a concern for our kids who might be experimenting with drugs like this. Illegal fentanyl is manufactured by criminal organizations and then often pressed into counterfeit pills that look almost exactly the same as regular prescription opioids. Fentanyl can be found in counterfeit pills or mixed with other drugs like meth, cocaine, heroin, MDMA, and oftentimes it's added without the user's knowledge. When it comes to illegal fentanyl, it only takes a little to lose a lot. A small number of the grains of fentanyl are all it takes to take a person's life. The opioid in this class is called heroin. Heroin is an illegal opioid. It comes in a powder form and also a form called black tar. The bottom line is that all opioids are addictive and users can overdose. Illegal fentanyl carries a higher risk for overdose and death because of its strength and potency. So what does it look like? Prescription fentanyl is prescribed in the form of transdermal patches, lozenges, tablets, or nasal spray. However, most recent cases of fentanyl-related harm, overdose, and death in Arizona are linked to illegally made fentanyl. It is sold throughout illegal drug markets, often mixed with heroin, meth, cocaine, as a combination product, with or without the user's knowledge. Most of the fentanyl consumed by young adults and teenagers is in the form of fentanyl pills, and that's where we turn our focus. The most common form of illegal fentanyl is pill form. These are some examples of those illegally produced counterfeit pills that contain fentanyl. They are designed to mimic prescription medications like Xanax or oxycodone, and they have none of the properties of the legal drug. These are counterfeit pills that contain fentanyl. Most of the pills found by law enforcement are blue with the M30 stamped on them. A new trend they are seeing is that the small pills are now being made in different colors. The pastel M30s still have the M30 stamped on them, but they come in several different pastel colors. One thing to keep in mind here is when these counterfeit pills are being illegally made, the person making the pills has no idea how much fentanyl is in each pill. It's kind of like making chocolate chip cookies. Some cookies may have more chocolate chips than others. In this case, some of the pills may have a lot more fentanyl than others, but the person using the pill would have no idea that the pill they're taking has a lot or a little fentanyl. Keeping in mind it only takes a little fentanyl to overdose. It used to be that 4 out of the 10 pills that were coming out of these illegal factories were laced with a deadly dose of fentanyl, and I believe it's now like 6 or more out of 10 is laced with a deadly dose of fentanyl. There are ever-evolving slang names that are used to talk about counterfeit pills laced with fentanyl. Some of the current most common ones include M30, represented by a blue circle with a white M. Looks similar to a blue M and M. They are also referred to as blues, and golden trails is a reference to when the pills are smoked and leave the golden trail on the tinfoil. These are additional street names for illegal fentanyl. If you see any of these names in social media or text, it may be cause for a discussion and action. Again, these aren't all the street names, but some of the most common ones. Here's a slide about how fentanyl is used. This is generally a slide about how most drugs can be used. They can be smoked, as mentioned in the previous slide regarding golden trails. Generally, this is happening on tinfoil and using a straw or a plastic pen. And as the pill is smoked, it leaves a gold line on the tinfoil. It can also be swallowed, snorted. The pills are crushed into a powder and then inhaled through the nose. The pills can also be crushed, heated, and then injected. Now that we have a better understanding of what fentanyl is, let's take a look at why this is a growing problem and needs urgent attention. One reason this is happening is because the pills coming across the border are coming in massive amounts. The Arizona High Intensity Drug Trafficking Area compiled data from all law enforcement agencies for the last 2 years. It shows the following. Seizures are up from 33.3 million in 2022 to 123.4 million pills in 2023. And that was just a 270% increase in 1 year. It is now 2026. So how the idea that this is continually increasing in an exponential way is mind-blowing. The Arizona Pediatric Fatality Review Report for 2023 found that fentanyl was responsible for all opioid poisonings. There were a total of 34 deaths, and 8 were children less than 5 years of age. Fentanyl is the number one substance found in opioid overdoses. In 2023, 75% of opioid overdoses involved fentanyl. But why? Why is this occurring? Let's find out.
Teens like me are dying from fentanyl poisoning. I know because I lost my brother Alex to one pill made with fentanyl. Alex didn't know the dangers of fentanyl and that one pill can kill. It can happen to anyone, and it changes everything. These pills look like they come from a pharmacy, but they don't. They're fake. Drug dealers on social media are not your friend. They take your friends. They took my brother. Don't let them take you. Fentanyl can end it all. Teens like me are dying from fentanyl poisoning. I know.
So it's a big
I
deal.
lost my
As I
brother
said, that's
Alex
just
to
another
one pill
young person
made
who
with
was
fentanyl.
lost to
Alex didn't know
experimentation
the
with these
dangers of fentanyl and that one pill can
pills
kill.
that look like prescription
It can-
pills. Something else to consider is that Trank is a new drug that is being mixed in with fentanyl, and it's called xylazine. That's the technical name. And it is a non-opioid animal tranquilizer. It is approved by the FDA for veterinary use only. Trank or xylazine is commonly found in combination with fentanyl. It's also being added to street drugs like heroin and cocaine to increase their effects. The combination of these chemicals increases the risk of overdose, severe wounds, and death. Common street names for trank are trank dope, zombie drug, and Philly dope. Because tranquilizine is not an opioid, naloxone will not reverse its effects during an overdose. However, because xylazine is almost found in combination with opioids like fentanyl, naloxone should still be administered whenever an opioid involved overdose is suspected. Also, the synthetic opioid carfentanil, which is approximately 100 times more powerful than fentanyl, is on the rise as well. This was developed for use as a tranquilizer for large mammals such as elephants. Carfentanil is a white or beige powder and appears similar to cocaine, heroin, and fentanyl powder. The effectiveness of naloxone in reversing the effects of carfentanil is questionable, according to the National Center for Biotechnology Information. Carfentanil poses a significant threat to users, law enforcement, personnel, and healthcare professionals. As you can see, it only takes one grain of carfentanil to potentially take someone's life. Also, we began seeing BTMPS in June of 2024 in Phoenix. This is according to Sherry Oz from the Drug Enforcement Agency in Phoenix. This is an industrial chemical that keeps showing up in the fentanyl supply, raising new concerns, according to Fox 10 Phoenix. Introduction of this chemical is due to new fentanyl formula because of precursor restrictions imposed in China. So because the chemicals that are making fentanyl are coming from China, this is being infiltrated in that way. The Laboratory Analysis Response Center, otherwise known as LARC, is a new mobile lab designed to test drugs seized by authorities. Before, agents had to mail evidence or drive evidence to the DEA's office in San Diego. DEA Phoenix, industrial chemicals are very dangerous, and these might pose similar or different risks to people who are ingesting them. The Industrial Chemical Testing Laboratory, LARC, they say, we are the first mobile lab here in Arizona, here in Phoenix. It's important for us to get the information right away. Just in June, we started seeing this BTMPS. It's a new compound that we're seeing looking like fentanyl pills, looking like M30 blue pills. We found it here in Arizona in June, and by August, we had seized it in all of the United States. There are other drug threats as well coming through, nitazines or other novel potent opioids. According to the DEA, these were first identified in the Midwest in 2019. They are more potent than heroin and morphine. The source of this is the DEA Bulletin, New Dangerous Synthetic Opioid in DC, emerging in the tri-state area. Emerging group of synthetic opioids may be more potent than fentanyl, the study warns. Also, during Operation Press Your Luck, announced on Monday, September 30th, 2024, the Drug Enforcement Agency discovered that a UAE-based victim had ordered what she believed to be oxycodone from an online pharmacy only to receive a fake pill made with fentanyl. The pill looked identical to real oxycodone, but it was not. It was made with fentanyl and filler. Days after receiving the medication, the victim passed away from acute fentanyl poisoning as a result of taking one of the pills sent to her. There are many reasons why kids and other people are experimenting with substances. Every person's story is different, and these reasons do overlap. For some youth, this may be because it's the next substance to try. It may be a teen who drinks alcohol or vapes and has heard about pills, so they try them out of curiosity or just not knowing sometimes that they contain illegal fentanyl, but then they are willing to take the risk. Many use drugs to cope with emotional stress, pain, or untreated mental health problems. For many of these teens, it's a form of self-medicating. Stress can come from school, life, family members. Some people start using prescription pain pills through a prescription or recreationally, then develop a tolerance and need to find additional sources for those pills by going to social media or any other illegal source, not knowing the counterfeit pills may look real and they are not, and often contain fentanyl. Is your child or family member at a higher risk? There's certain factors to watch out for that may put your person at a higher risk for substance use disorder. It's important to keep in mind that these factors do not determine a person's destiny. Instead, they provide a general gauge as to the likelihood of drug use or susceptibility to addiction. Understanding risk factors is also very important when a person has already experimented with substances like alcohol or marijuana or other party drugs, because he or she may be more susceptible to trying opiates. We also need to change the perception of people who use drugs in general. Implicit bias is a well studied phenomenon. The phrase refers to the unconscious attitudes we have towards people or groups, both negative and positive. Thoughts and feelings are implicit if we are unaware of them or mistaken about their nature. Implicit bias describes the automatic association people make between groups of people and stereotypes about those groups. Under certain conditions, those automatic associations can influence behavior, making people respond in biased ways, even when they are not explicitly prejudiced. So, what can you do? Encourage people to be aware of their own biases and beliefs. Educate them on the risks associated with implicit bias, specifically as it relates to substance use disorders and recovery. Be mindful of our attitudes and personal biases can help us avoid being or behaving according to ways that are not helpful. If we don't choose our words and attitudes carefully, we can potentially perpetuate bias, cloud understanding, and end up distancing ourselves from the people we want to help. The impacts of stigma and implicit bias can be significant for individuals living with substance use disorder. It can lead to feelings of shame, isolation, and self stigma, which can make it harder for people to seek help, access treatment, and maintain recovery. We can talk a little bit more about stigma next. What you see on the outside might not be what's on the inside. Just remember, you cannot judge a book by its cover. Stigma is a form of discrimination against an identifiable group of people, a place, or a nation. Stigma about people with substance use disorders might include inaccurate, unfounded thoughts like they are dangerous, incapable of managing treatment, or at fault for their condition. Often unintentionally, many people still talk about addiction in ways that are stigmatizing, meaning they use words that can portray someone with a substance use disorder in a shameful or negative way. With simple changes in language, harmful stigma and negativity around substance use disorder can be reduced or avoided. There are various ways that people can combat stigma, whether it's on a personal level, a professional level, or at the community level. Try using supportive language. Put the person first. Revise words and terms when using terms that discuss substance use disorder and those affected by it. Language matters, and language around substance use has evolved to decrease the stigma of substance use disorder. Person first or person first language prioritizes the person over the illness, disability, or condition. People first language asks us to be mindful of the impact of the words that we used. Due to the prevalence of stigmatizing language, a person who is living with substance use disorder may not be able to see themselves as anything other than that disorder. Be aware of your own personal biases. Become aware of the stereotypes you hold and create non-stereotypical alternatives to them. See each person as an individual, not a group member. Pay attention to things about them besides the stereotypes of their group. For education on personal development, educate yourself about substances and their substance use disorders. Attend trainings to further your understanding, such as trauma-informed care, implicit bias, or stigma training. Seek ways to get to know people away from different social groups. Build your confidence in interacting with people who are different from you. Now that we have a better understanding of fentanyl, let's look at the tools and resources we can use to respond. Parents and caregivers. Some of the greatest impact on kids can come from their families. Please note, when we say parents, we mean anyone who cares for a child. When we take a look at what we can do, let's see what the kids are saying. 7 out of 10 of them say that their parent or caregiver has never talked to them about fentanyl. So where are they learning about it? 1 out of 10 say that fentanyl is sort of easy or easy to get. It's time that we all join together and educate the kids on the risks and harms of fentanyl. The source of this information is the Arizona Youth Survey. Basically, it's just asking kids during the past 12 months, have you talked to a parent or guardian around the dangers of fentanyl? 34% of kids said yes, somebody had talked to them. And 9.5% of kids said it would be sort of easy for them to get blues. So, where should we start? The first place is to begin educating kids about fentanyl. First, ask them what they know, if they've heard about it, then share with them that knowing about fentanyl helps keep people safe. Let your kids know that because fentanyl is dangerous, the safest thing that you can do is not use drugs. Also, with the information you're providing to them, they'll be more likely to use this information to help a friend. Cover the basics of fentanyl. Fentanyl is very common and deadly. It's used to make fake prescription pills that are much, much more dangerous. You cannot see, smell, or taste fentanyl. While these pills may actually look like the real thing, they are not. Urge your kids to only take pills that have been prescribed specifically for them. Prescription pills bought online are fakes made with fentanyl, potentially. Even a pill from a friend may not be safe. Don't take any chances. Next, establish a rescue plan with your child. This can be a secret text or phrase that you and your child agree upon. If they text you with the code word or call you with the code phrase, that's the cue that they are ready to go home. They're in a situation and they need to get out. An example might be if your code phrase is, I forgot to feed the dog. When you see that message in the text, if your child tells you that in a phone call, you'll know that's code for come and get me. You might respond with something like, that's the third time this week you've forgotten to feed the dog, and it's your responsibility. Where are you? I'm coming to get you right now. Ask the audience. Put in the comments down below. Do you have a rescue plan with your child? If you have one, would you be willing to share what it is? Tell us your code phrase in the comments below. You can find tips and helpful information on how to get the conversation going at talknowaz.com. Because so many of our kids are now getting pills and other substances from social media and texting, it's very important to monitor social media sites. Before your kid gets on a social media account, they should know and need your permission before joining one of these sites. Ask your child for their usernames and their passwords. Keep track of them. Set limits on how much your kid is spending online. Talk with them about what people are talking about online and what their thoughts are on that. We have another presentation specifically on this. It's on how kids get drugs from Snapchat. If anybody wants a full presentation on that, it is a 2-hour presentation, and you can contact me at the contact information on the last slide of this presentation. It is not uncommon for today's teens to have entire conversations via emojis, making it easy to dupe parents and keep the true meaning of their conversation hidden. Whether your child is using emojis, and you can pause the presentation here to look at this. Here are some of the current ways that drugs are referred to with emojis and acronyms. Here's some more emojis that are being used online to buy and sell drugs. Sometimes kids will seek out drugs such as Adderall and Xanax, but they will be counterfeit pills laced with fentanyl. You might do all that you can to help your teen avoid substances, but when you take them to an emergency room for a broken bone or other injury, they might receive an opioid painkiller. Your son or daughter might also receive an opioid prescription after dental surgery. Ask your healthcare provider or dentist whether there are alternatives to ease the pain that don't involve opioids. Some alternative pain relief methods include non-steroidal anti-inflammatories. This would be your average ibuprofen, naproxen, Aleve, Advil. They reduce swelling and soreness. They are often used alone for mild to moderate pain. Acetaminophen, which is Tylenol, is often effective in treating headaches, minor aches, fevers, and pains, but does not reduce inflammation and swelling. Local anesthetic. This is like an injection that you get at a pain center. They can block pain in small areas of the body and are given in a shot near a surgical incision or as an epidural, potentially through a small tube in your back into the spine. There are also alternative approaches like acupuncture, physical therapy, and massage, which could help reduce the need for opioids. Make sure to communicate with your medical professional. Don't be afraid to speak up on behalf of yourself or your kid if you don't want to get started on an opioid prescription. Also know that abuse of medications is still occurring, so make sure that you store medications in a secure location. If you have medications in your home that you're no longer using, there are many locations throughout the state to drop off these unused, unwanted, or expired medications, including your local pharmacy or drug take back events that are sponsored by the Drug Enforcement Agency. Also, very important to know is recognizing the signs of an overdose. Here are some of those signs: awake but unable to talk, unresponsive to being touched. Fentanyl affects the heart and lungs. These organs slow down and weaken, and the entire body can be affected. Erratic breathing leads to snoring, gurgling, or choking sounds. The lips, fingernails, or skin can turn pale, blue, or gray. The skin can feel clammy or sweaty. Pupils might be pinpoint in size. If you encounter a person experiencing these effects, the first thing to do is call 911. It's important to note that Narcan can reverse an overdose. This is a text exchange that was made between two teenagers. This was the last text that this teenager sent before passing away from an overdose related to fentanyl pill.
Have you heard of Arizona's Good Samaritan law? If you are using drugs and someone you are with is experiencing an overdose, call 911 immediately and get help. You will not be charged or prosecuted for the possession or use of a controlled substance or drug paraphernalia if you seek medical assistance for someone with a drug-related overdose. Arizona's Good Samaritan law saves lives. Have you heard of Arizona's Good Samaritan law?
While the person told,
if you are using drugs and someone you are with is experiencing an overdose, call 911 immediately and get help.
In most cases, there are
you will not be charged or prosecuted for the possession or use of a controlled substance or drug paraphernalia if you seek medical assistance for someone with a drug-related overdose. Arizona's Good Samaritan law saves lives.
Which is really important. It should always. Naloxone reverses an overdose by working to restore breathing and heart rate. It's critical that this medicine is used by first responders, but anyone can now get it. Naloxone and a prescription is not necessary. In fact, Narcan, a nasal spray that contains naloxone, is available over the counter. It was about $40 a box the last time I checked. Make naloxone part of your first aid kit. Do not be afraid to have this in your home. Find the nearest location by scanning this QR code or going to naloxoneaz.com.
If this can be assistance to even the one person, that's what it's about. It's not about me. It's not about John Crow. But I did do drugs. I did overdose. I did get a second chance by the help of Narcan, paramedics, police officers. I lost nursing school. I was homeless. I had nothing. Now I have a house. I have a job. I have beautiful connections. I love the Lord. That's where I'm at now. If this can be assistance to even the one person,
we do recover. People who are saved using naloxone can have the potential to recover and stop using drugs altogether.
I did get a second chance.
It might not be the first time they're saved. It might not be the second time they're saved. But it's always worth saving somebody so that they can have the potential to get into recovery. Discovering or knowing that your child is actively using an opioid could create a lot of emotions. Some parents are angry and disappointed. Others are fearful over the possibility of what might happen, and still others might feel guilt or shame. But there is hope, and treatment works. If you have found out that your child is using fentanyl pills or an opioid, make sure you get treatment for them right away, and ensure that you have naloxone around so that you can be safe. Determine the best course of action for you and your child. An evaluation with a certified professional is a crucial step. The person will ask many questions, and various assessments will be used to determine what kind of care might be best for your child or family member. Your insurance company can provide recommendations for evaluations as well as your child's doctor. Other helpful resources can be a school counselor or an employee assistance program or a support group. Sometimes teens and young adults are more willing to engage in treatment because they recognize the consequences of their actions and want to lead healthier lives. In other cases, it's not that straightforward. You will need to use your influence and possibly leverage to make that happen. You may have heard that your son or daughter needs to hit rock bottom or to want to get help or to get better, but that is not true. Our loved ones are often interested in getting help. More importantly, in the case of fentanyl, hitting rock bottom can mean death. For more information regarding treatment, Arizona has an opioid assistance line. You can access this 24 hours a day. This is a good first step if you're wondering where to start. 3 important things to do when you're seeking treatment for a loved one are ask questions. Not all treatment providers are created equal, and different programs have different approaches. The Partnership to End Addiction has developed a treatment ebook that identifies questions to ask of a provider. Substance use disorders are chronic and recurring. It is important to provide continuing care, and another ebook from the partnership provides information on that topic. Finally, it is important for caregivers to take care of themselves. Helping a struggling person with substance use disorder can be exhausting and overwhelming. There is a parent support network, which we'll talk more about, that can help provide ideas in that area. These are tools designed for parents and caregivers. There is hope and a help texting program. This slide shows how it works and if there is a flyer available with directions. There's also individualized parent coaching offering peer-to-peer support. If you'd like to access a parent coach, you will be matched up with someone who has been in a similar circumstance to you. Your coach will provide encouragement and support. There's a flyer on this as well. To learn more about any of these topics we've discussed today, please visit the websites we have listed right here on this slide. We also have listed a few resources for those who are seeking help. So thank you for another presentation by ALT, A-L-T, All Life Transitions. We are a mental health charity in Phoenix, Arizona. My name is KJB, otherwise known as Kara Jean Bry. I'm a licensed professional counselor operating within the state of Arizona, Minnesota, Ohio, and Louisiana. I do specialize in substance use, among other things, and I would love to hear from you if you are looking for help in any area or a training of this kind being brought to your location within the state of Arizona. Again, thanks for watching this today, and if you could hit the like button, subscribe to our channel for more and additional trainings. We are uploading as often as we can. Thank you. Have a wonderful rest of your day.